Good morning, Miss Selena. My name is Esther and I'm your CNA for today. How are you doing? Great, good. I'm also good. Fine, thank you. So I understand you called to use the bathroom. All right, I am going to assist you use the bathroom, but before that, let me quickly go wash my hand and gather my gloves and I'll be right back, okay? Wait for It's important to wash your hands almost all the time before you touch a patient. It is also a requirement on the CNA checkoff list. So let me show you how to wash your hands properly. First, you have to make sure you don't have anything in the way, your watches, your rings, or any other thing that can hold on to germs, dirt, and hinder you from washing your hands properly. Okay, first and foremost, you have to turn on your water. Most people will go ahead and grab the soap. If you do that, you are not able to lather your hands properly and the germs will still be sticking onto your hands. You can realize that I turn on the water, but make sure it wasn't splattering because the sink is considered dirty and you don't want the water to be splattering on you. Also, you have to make sure that your temperature is right. It's very normal, not too hot, not too cold. You don't want to burn your hands and create cracks on your hands for germs to get in. Let's wet our hands. Sometimes most sinks are very tight and very close. You have to make sure you don't touch any part of the sink. Remember, I said the sink is considered dirty. Why would we wet our hands before we put on soap? If you know that, type it in the comment section. So, you grab an amount of soap. Very important. You have to make sure the soap is enough to go through the procedure. Make sure you lather the soap in the palm of your hands like that. This is also helping you clean the palm of your hands. Then you move on to the back of your hands. You have to be strong and vigorous. Then you go on into your fingers on both sides. Then you rub your knuckles on both sides. Your fingernails in the palm of your hands. I need you to pay close attention to the steps. Then to your wrist. You see why you need to get away everything that is on your wrist? Because you need to get your wrist and clean them properly. You can do the motion one more time, then rinse your hands. Make sure you are not touching the inside of your hand, of the sink. And then always make sure that your fingernails are pointing into the sink or towards the sink so you can get all the water drained. This sink is really tight. Drain the water or keep your hand in the sink for at least a few seconds before you grab a towel. It is always necessary to wipe your hands drop and use another towel to turn off the faucet. Never use your clean hands to turn off the faucet, because remember, the whole sink is considered dirty. Now, we have clean sets of hands. It's always important to touch your patient or any other person with clean hands. Let's go help her into the bathroom.